It's 2 a.m., the house is quiet, and then you hear it. A low whimper, a soft cry. Your dog, somewhere in the dark. You tell yourself it's nothing. They're dreaming. They want attention. They'll stop. And maybe they do, eventually. But here's what most dog owners never find out. That crying at night is one of the most misread behaviors in canine psychology. The real cause is almost never what owners assume. And when left unaddressed, it doesn't just affect your dog's sleep. It reshapes their entire psychological state permanently. This video is going to change how you respond when you hear that sound. 1. Why your instincts are wrong. When a dog cries at night, most owners land on one of two responses. They either ignore it, hoping the dog will self-settle and learn that crying doesn't work, or they go to the dog, give attention, offer comfort, bring them into the bedroom. Both responses make sense on the surface. Both miss the root of the problem entirely. Because the question isn't how to stop the crying. The question is, what is the crying actually communicating? And the answer is different depending on the dog, the age, the history, and the specific pattern of the crying. Nighttime vocalization in dogs is not a single behavior. It's a category, and each type has a completely different psychological origin and a completely different solution. 2. The 5 real psychological causes. Cause 1. Separation distress. This is the most common and the most misunderstood. Separation distress is not the same as separation anxiety, though the two are often confused. Separation distress is a normal emotional response to isolation. Separation anxiety is a clinical condition involving panic-level responses even during brief separations. When a dog cries at night due to distress, they are experiencing a genuine emotional need for proximity to their social group, you. Dogs are pack animals at a neurological level. Isolation at night goes against every instinct built into them over thousands of years. The crying is not manipulation, it is distress. There is a critical difference. Cause 2. Cognitive dysfunction in older dogs. If your dog is over 10 years old and has recently started crying or howling at night, particularly if they seem confused or disoriented when you find them, this is a significant warning sign. Canine cognitive dysfunction, or CCD, is the dog equivalent of dementia. It affects up to 68% of dogs between the ages of 15 and 16, and it often surfaces first at night. Affected dogs lose their sense of time and place in the dark. They feel lost in a familiar house. The crying is confusion and fear, not a behavioral issue. It requires veterinary assessment. Cause 3. Pain or physical discomfort. Dogs are instinctively wired to conceal pain during the day when they are active and stimulated. At night, when the house is still and there are no distractions, pain surfaces. Joint pain, digestive discomfort, dental pain, or an undiagnosed injury can all produce nighttime crying that looks like a behavioral problem but is actually a medical one. If the crying is new, sudden, and accompanied by restlessness, reluctance to lie down, or changes in posture, see a vet before trying any behavioral intervention. Cause 4. Anxiety imprinted in puppyhood. The first few weeks of a puppy's life at home are a critical window for emotional programming. Puppies who are left to cry without any form of reassurance during this period do not learn independence. Research in veterinary behavioral science has shown they are more likely to develop chronic anxiety, noise phobia, and insecure attachment as adults. Dr. Karen Overall, one of the world's leading veterinary behaviorists, has been clear on this. Leaving a young puppy to cry in isolation is not training. It is exposure to a level of stress that can alter brain development. Cause 5. Environmental triggers. Sound frequencies humans cannot hear. The distant howl of another dog, a change in the home's scent, a new baby, a family member who has left. Dogs process the environment on a sensory level that goes far beyond human perception. What sounds like silence to you may be full of information to your dog. If the crying happens at a consistent time each night, something external in the environment is almost certainly the trigger. 3. The real cost of ignoring it. Here's what the research tells us about what happens inside a dog's brain when their nighttime distress is consistently ignored. In the short term, the dog may stop crying, not because they feel better, but because they have learned that crying produces no response. This is called learned helplessness, and it is the opposite of resilience. A dog in a state of learned helplessness doesn't become more independent. They become more withdrawn, more shut down, less able to signal their needs day or night. Long-term studies in canine stress responses have shown that dogs who experience repeated unresolved nighttime distress show elevated cortisol levels, the stress hormone, throughout the following day. Chronic elevated cortisol in dogs is linked to suppressed immune function, digestive problem, increased reactivity, and shortened lifespan. The silence you finally hear at 3 a.m. is not peace, it is surrender, and your dog deserves better than that. 4. What actually helps? So what do you actually do?
Come here.
Step 1. Identify the cause before you address the behavior. Use this framework. How old is your dog? When did the crying start? Is it every night or specific nights? Does it happen at a particular time? Is it accompanied by confusion, restlessness, or physical symptoms? The answers point you to the cause. Step 2. Rule out medical causes first. Before any behavioral approach, a vet check is essential if the crying is new or has changed. Pain and cognitive dysfunction cannot be trained away. They need to be treated. Step 3. For distress-based crying, presence is not the enemy. Contrary to outdated advice, going to a distressed dog at night, calmly and without drama, does not reward the behavior. It addresses the underlying emotional need. A calm hand, a quiet voice, and a brief moment of reassurance, followed by a clear, consistent cue to settle, is far more effective than isolation. Step 4. Build a pre-sleep routine. Dogs are deeply routine-dependent creatures. A consistent wind-down sequence, a final short walk, a specific settling spot, a consistent verbal cue like bedtime trains the nervous system to shift into rest mode predictably. The more predictable the transition to night, the lower the anxiety around it. Step 5. Never punish nighttime crying. Shouting, scolding, or any form of punishment for nighttime vocalization will always make it worse. You are adding fear to an already anxious state. The dog does not connect the punishment to the behavior. They connect it to you. And that damages the one thing that makes everything else possible: their trust in you. 5. The emotional close. Think about the last time you heard your dog cry at night. Maybe you were annoyed. Maybe you were worried. Maybe you pulled the pillow over your head and hoped it would stop. All of that is human. All of that is understandable. But now you know what that sound actually is. It is your dog in the dark, without language, without the ability to explain themselves, reaching out to the one being in the world they trust completely. They are not being difficult. They are not misbehaving. They are asking for you. And now that you understand what they're really saying, you can actually answer them. In the next video, we're going somewhere even deeper, because your dog doesn't just struggle at night. There are dogs right now in loving homes with owners who care deeply, who are grieving, not because someone died, not because they were abandoned, but because something shifted in the home, something changed, and nobody noticed. Your dog is grieving in silence, and in the next video, I'll show you exactly what that looks like and what you can do about it. If this helped you understand your dog a little more tonight, share it with someone who needs to hear it.